Hi friends, today we are going to see one more important problems what females face in their breast development. It is called tubular breast or tuberous breast. It calls in various names, but commonly tubular or tuberous is the commonly used names. What is the tubular breast? See, there are variety of reasons breast development won't happen normally. This is tubular breast is abnormal constriction of the surrounding area of the breast, so that breast will be like a root or a tubular. So because of this, lot of mammary tissues will be accumulated just below the pigmented portion of the breast, that is the areola. So there are variety of tubular breasts are there. It is a very commonly seen problem, but women are not aware of this problem. So they don't know there is a solution for this, because even doctors cannot diagnose this because they are not trained to do it. Even the pediatricians and other doctors, other specialty people, they are not trained to identify this developmental problem. So three stages of the tubular breast is there. First stage, the inner side of the breast. Say example, this is actually the implant. I'm just keeping it for the example. If it is the breast, this is the midline. The inner side of the breast, in the inside below, won't develop properly. Therefore, there is a constriction here. Stage 2, inner as well as the outer side of the breast, both will be constricted like this. On third stage, inner, outer and all around, there will be a constriction. So only the breast tissue will be in the center. So it started sagging like this. It's a tubular and a root kind of a thing. So it's not only like a problem. Some people it will be a one side, some people both the sides, some people varying degree. So it causes lot of mental trauma to the patients, as well as they will be going through a lot of stress, and they can't even explain this to anybody. I've seen a lot of the tubular breast women, when they come for a consultation, in fact they literally cry. We don't understand their mental agony. Even going to the brassiere showroom and getting the bra, proper sized bra, it is very shame for them to make the girl understand, the brassiere girl understand what kind of a bra they want. It's lifelong mental agony for them. I treat a lot of patients with different size breast, one side tubular, one side the saggy breast. Even husbands can't understand why she's asking for a surgery. This is not because the husbands are asking for it. It's basically their self-esteem. They don't feel normal, they don't feel happy about this. Even I've seen people coming after a few deliveries at 40, 50, they don't feel happy. It's a constant nagging thing in their body which affects their self-esteem a lot. So the tubular breasts are very common. It is 100% treatable. Understand this. What are the ways you can find out the tubular breast? See, in the tubular breast, other problem is the pigmented part of the breast, that is the areola, the black color thing, the pink color thing, will be puffy and enlarged. It's other problem what usually the females will see. The gap between two breasts will be wide, and the distance between the nipple and the natural crease of the breast is very less. So the breast will be saggy like this. These are all other common finding what usually you see in the tubular breast. The treatment, there are a lot of options are there according to your stage, which stage you are in. Usually simple releasing with the cannula, that wherever the constriction is, and put the fat graft is one simple option. Second option is make the areola cut. The pigmented portion of the breast, if the pigmented portion of the breast is here, make it underneath the pigmented portion and go and release the constrictions here and go behind the muscle. We do something called dual plane. Open the muscle and keep the implant so that the lower part will be pressing it down, upper part of the implant will be covered by the muscle. This technique is excellent for this tubular breast, but keeping it subglandular will be more better option, but again the capsular contraction, other complications are more, so better to keep it under the muscle. That is a better option for the tubular breast. So these are a lot of variety of treatments are available. Sometimes one side tubular, we do the tubular breast correction here. Sometimes areola reduction and correcting the herniated portion of the breast tissue and correcting the areola size also along with the implant. Sometimes one side tubular breast correction, other side breast lift techniques. These kind of various procedures are attempted according to the particular problem what they are facing. So it's a psychological agony. Obviously, the plastic surgeons understand. You have to make your family people understand what you are going through and get their help, and so we can help you. Thank you.